Hello, UIC College of Pharmacy friends and family. This is Mike Koronkowski. I'm a faculty member here in the Department of Pharmacy Practice at the college, and I just wanted to share some stories that kind of occurred this semester in our learning process that kind of driven home a couple important messages for me and hopefully for you, and I wanted to share those. We have a couple interprofessional classes that get students and learners from multiple professions, specifically medicine, nursing, pharmacy, and public health, as well as social workers together for interprofessional learning using the community as our classroom. And we do that in a way to really address the issues of teamwork, communication, roles and responsibilities of healthcare providers, and teamwork. And we really focus in on marginalized or vulnerable populations. And at no time is it more important than now, in light of the crisis we have going on with healthcare and the threats with the coronavirus, that these marginalized populations need us as healthcare providers to work together to help solve some of these challenges. So some of the projects and populations that the groups worked on is geriatrics as a marginalized population, homelessness, incarcerated populations, immigrant refugees, and intimate partner violence populations. And again, working as teams, they do needs assessments, they implement a health program to address some of the needs of that community, and do it as a research project with outcomes. And really it's a way for health professionals to give voice to a population that doesn't have a voice, and to help understand the needs of those communities in terms of the complexity with mental health, substance use disorder, and as a population as a whole being marginalized in our healthcare systems. You know, I share with you a quote from Martin Luther King Jr. that I think resonates and helps to strengthen the point. Martin Luther King spoke and said, of all the forms of inequalities, it's injustice in healthcare that is the most shocking and inhumane. And just think about the populations that I brought up today. The geriatric population, incarcerated populations, homeless populations, immigrant refugees. If we look at how the healthcare crisis of COVID has exposed these inequities, has exposed the disparities, has exposed the injustices that we often see in practice, and they play out across the board. The older adults are dying disproportionately. 25% of all deaths in the state of Illinois are in people over the age of 60. Furthermore, if you stratify that by race, 72% of the people dying of COVID are African American. So again, these marginalized populations, we see an uptick in domestic violence. We see incarcerated and homeless populations with higher rates succumbing to COVID. And we see the polarizing and politicalization of immigrant and refugees in this country. So here we have a time of a crisis where we want people to come together, and we see it exposes the inequities of care, especially in these marginalized populations. You know, an interesting book that I read recently by David Ansel was called The Death Gap, which chronicled the health disparities and inequities of care based on zip codes in the city of Chicago. And you know, the voice that we can give as providers to these marginalized populations is invaluable. So I pose two questions to you to ponder, to think about, to reflect. During this time of COVID, you as a healthcare provider, as a pharmacist working across the continuum of care, have you witnessed or seen some of the challenges that COVID has presented, especially in these marginalized populations? And what actions have you taken once you're aware of these things? Thank you. Have a good day.